right, good morning, everyone. Hope you are staying cool. Have plans to stay cool wherever you are today. We do have an extreme heat warning in effect here in the area. Want to go over our agenda today for the Recovery Committee group. Steve's going to update us on the dashboards. Then we'll have a health officer update with Dr. Velazquez. Then Steve will do some general response updates. I have GSI on for an update as well. And then under open discussion items, I do want to share where we are in the phases review that that document that we've been working from. So, Steve, I will let you get started unless anyone has any additional items. I'm not seeing anyone wave or anything. Feel free to stick those in the chat and I'll grab them. Thanks.
All right. Happy Toasty Tuesday, everyone. So for our previous week, cases are down significantly. We reported 261 new cases last week. There were 360 the previous week. That takes our daily average down to 37 a day from 51 the week before that. Our 2-week total is at 621 cases, and our rate per 100,000 is 119. For reference, that is our lowest 2-week case rate since September of 2020, which is incredible. The week before it was at 149. So for age groups impacted, it remains largely the same. Those between 20 and 29 are about 20% of cases. 40 to 49 are 17%, and then it's kind of split out evenly. There is really low case rates among those who are highly vaccinated in the older age groups, including 70 to 79, which is at 5%, 80 to 89, only 8 individuals, and over the age of 90, we only had 3 individuals. So for our hospitalizations, those remain pretty steady. We had 29 new Spokane resident hospitalizations last week. We reported 27 the week before that. That puts our 7-day rate per 100,000 at about 5.5. It was 5.2 the week before that. And currently hospitalized in Spokane County, so that's residents and otherwise, we have 35 individuals. Unfortunately, we did report 5 new deaths last week, including 2 individuals in their 60s, 2 in their 70s, and 1 individual in their 90s. We only reported 3 new deaths the previous week. Our testing numbers are going down pretty consistently. This is the same across the state. We conducted 4,440 tests last week, and that's about the same as the week before that, bringing our average down to 634 per day. But our testing positivity rate continues to decline pretty steadily. We're at 6.1%. It was 6.5 the week before that. For healthcare system readiness, the number of staffed beds available is 1,077. Licensed beds is 1,501. The total occupied census for staffed beds is at 91.1%. For licensed beds, that's 65.4%. The total COVID census continues to be pretty low. For staffed beds, that's 3.2%. Licensed beds is 2.3%, and our ICU census, so that's all cases, is at 87.5%, which is pretty high. Our vaccinations continue to increase. To date, we have given 421,194 doses in Spokane County. The percent of people initiating vaccination, all ages, is at 44.8%, or 233,895 individuals. For those over the age of 16, it is 54.4% of the population. And then for people fully vaccinated, it is 40.1% of the total population, or 49% of the population over the age of 16. We continue to investigate cases and work with contacts. Last week, we investigated 264 cases, so almost all of them came through us, or actually all of them came through us. And we reached 61% of those within 24 hours. Our isolation facility continues to provide services for those who need safe isolation and quarantine facilities. We currently have 6 individuals in the census there. Our business technical advisors continue to work with businesses in the community. Our total consultations to date is 7,792. Last week, we completed 50 of those consultations, putting our total referrals up to 7,500. And for long-term care and congregate activity, We only reported 1 new outbreak in long-term or congregate facilities, and there are 7 currently active outbreaks in those facilities. And that concludes my data report. Any questions?
Thank you, Steve. Not seeing anyone come off of mute or anything in the chat. So why don't we head into Dr. Velazquez's report, and if anyone has questions, we can always come back to those. So Dr. V.
So good morning, everybody. Just want to make a comment on vaccines, and then I want to talk a little bit about the transition from education to summer camps, a little bit about the heat, which is a consideration and a concern this week, and then a couple of comments about some of the variants and what the meaning is as we continue our goal of pursuing 70, 80% of immunization in the area. So if you look at the state of Washington, and there's 2 numbers that usually get looked at pretty much. One is how the CDC calculates your percent immunization, which they use 18 and older, and how we in the state of Washington are calculating our immunization rate, which we're using 16 and older, with a caveat that that we're doing 12 and over, but the June 30th target was set on the 16 plus. So if you look at that, we're at 68.2% for the state of Washington. If you look at the CDC, we're at 73.1%, which is good. In Spokane, I prefer to think that we're only 15.4 away as opposed to the 50 something. But we're slow and steady. We've continued every day a fraction of a percent. And I am enthusiastic that we're going to continue doing that. And regardless of the direction that we get from the governor on the 30th, our goal continues to be to hit that 70 and then exceed it as we go forward. And one of the reasons for that is because, as we all know, the pandemic is not over. There's some work we need to do. Immunization is the best tool that we have. And we have a couple of variables with the variants for which vaccine is highly effective. So that's the rationale behind this continued goal of reaching a high population percentage of immunization for those that are eligible. So I want to give you that context. So when I talk about the variants, we'll focus a little bit on those, a little bit more with the preamble that vaccines are highly effective with particular variants of concern. So first and foremost, a quick update from our education. As you know, most schools have finished their academic year, and we've seen graduation and outdoor graduation parties everywhere, although this week we need to be careful with outdoor activities, but over the last week or so, we've seen a few of those, and I do appreciate people taking advantage of the outdoors when the weather was a little bit better to have safer gatherings for graduations. So the team here transitioned a few weeks ago to 2 things. One is after academic year impact survey. So basically is the equivalent of a customer survey, year-end customer survey, which we conducted with all of our academic partners, including superintendents, principals, headmasters, school nurses, COVID-19 response teams, and other stakeholders. We did gather all of the responses, and we'll meet with our schools mid-July to go over that. Our goal was to determine what we did well, what we could do better, what did we learn, and how can we improve going on to the next academic year. And although I'm not going to go through all of the results today because we have not shared those with our academic partners as of yet, I can tell you the highlights, and the highlights is, first of all, the percentage of extremely satisfied, very positive feedback is in the mid-90s for most categories. And it's not that we ask easy questions, it's that the effort of the team has been acknowledged. We have spoken about the good relationship that has developed with our educational partners, and I think that was just a reflection of that. The biggest highlight, number one, our academic partners want to continue the close relationship that we have developed into the next year and on a go-forward basis. And I'm happy to hear that because I think it's very helpful. COVID is not the only thing that we need to work with our schools. I mean, there's a lot of other things that having developed this good working relationship is be important as number one. Number two, many of the updates we did over the last this academic year that started January, such as the office hours and the updated flow charts and the website, etc., got really, really, really high marks. Very positive feedback from our partners. The testing strategy got extremely high marks, and many comments that came to us via the superintendent from the parents. The parents saw it as a game changer, as it allowed us to keep our schools open and our students in the classroom, as opposed to having significant numbers of people quarantined without a testing strategy. So a few lessons learned. We'll apply those as we go forward, but I wanted to share that with you. And after we share that with our academic partners, we'll be happy to get into more detail, because we do have that meeting with them. I think it's in about 2 weeks. So we transitioned to summer camps. And the reason why I bring summer camps is because those are in full swing. And there are a couple of areas that we have been working with our summer camp partners, applying the same strategy that we apply to education. We do have office hours for the summer camps. We have developed the flow charts, and there's significant information on our website. So I want to encourage anyone that knows of camp directors or has any summer camp activities, please go to our website. There's tons of information, which we constantly update depending on what the guidance is from the various entities that we follow. And one of the questions that we've had a lot is about facial coverings in extreme heat. So there's some guidance there as to how to manage that in a way that is safe for participants in the summer camps. So more to come on that. We will continue working with our summer camps throughout the summer and updating as guidance becomes available, the same way that we work with our school partners during the academic year. Because summer camps are not all related to schools. We have summer camps we have sports summer camps, arts and culture summer camps. We have lots of types of summer camps, and that's an important activity for young adults and children. So as we continue to do that, let's talk a little bit about heat. And thank you to all of our partners, many of whom are here. We've been working very closely together with the city, the county emergency services, and all of our partners in the community around the cooling centers, thanks to the city and Catholic charities who actually open a few more. Because with the extreme heat, which, frankly, I have not seen this since I was living in Texas, so it's a little bit unusual in Spokane, but, we'll deal with that. There is a concern not only about the high temperature, but about the duration of this heat wave, which is basically a week, plus or minus a day or two. And that is a significant concern, particularly for many of our folks that are vulnerable, maybe on the street, may not have a safe place. So lots of information that we have released. There's a lot of information on our website, and our teams that are typically outside, such as our immunization team and our testing teams and our homeless outreach coordinators and our community workers, they are all armed with information that they're handing out as they see people with directions of what to do, where to go, where things are, pointing them in the right direction. We're also deploying water with them, and I do understand that some of the folks that work for the city also have a lot of water with them, and they're handing that out. So it's very important to stay hydrated. So we tend to forget that heat is a physical impact that can cause a lot of issues, and the milder forms are typically heat rash and sunburn, which many of us have suffered through. but it progresses steadily as your body temperature goes up from cramps to heat stroke, and heat stroke is by definition a medical emergency. So folks, stay cool, stay in the shade, use the cooling centers, hydrate. If you think anyone is suffering from heat stroke, please seek medical attention. Most important thing is remove them from the direct sunlight, try to cool them off, because their body temperature usually is around 103, but can go as high as 106, which is a dangerous body temperature. So we are taking this very seriously, and we'll continue to take this very seriously. I spoke with our healthcare partners yesterday about emergency room activities related to heat, and the good news is we did not see significant activity in the emergency rooms, which was a goal of going out with all of this information starting early last week, mid last week, and through the weekend. So let's continue doing that as a community and keep our folks safe. And if you're going to be outdoors, please be careful, hydrate, sunscreen, sunglasses, hats, stay in the shade as much as you can, and limit physical activity. So with that, I'm going to touch on the last subject, which is our variants. And I know over the last few weeks, we've heard a lot about variants and a lot about new names. And rationale behind that is a couple of things. First of all, we are tracking in the US right now 15 different variants. And globally, we are tracking 11 specific named variants. And the reason why I say named is because mid-June, the World Health Organization released a nomenclature based on the Greek alphabet. So now we have those 11 variants go from Alpha, which is the B117, also known as the UK variant, to C37, which is Lambda. And that is a new variant found in South Brazil over the last several weeks. Now, this makes it a little bit easier because we're standardizing the nomenclature. But one of the reasons why I want to talk about that today is because there are three specific variants that are at play right now that we're following very closely, because we're seeing a little bit of a shift in the dominance of the variants. So starting at the beginning, the three that I want to mention are the B117, which is the Alpha variant, originally identified in the UK. The second one is the B1617.2, which is the variant identified in India, which we know as Delta. And the last is the P1, the original Brazilian variant known as Gamma. And the reason why I bring that up is because we're seeing Delta and Gamma across the country displacing B117 as a predominant variant. And to give you some idea of where those things are, in the state of Washington, we've had 7,430 cases that have been sequenced that have a B117, which is about 47% of all the variants. In Spokane, it's 114 cases, which is about 24% of all of our variants. In the state of Washington, we've had 308 cases of the B1617.2, which is about 9%. That was 0% several weeks ago. We don't have any cases identified yet in Spokane County, but the Gamma, which is a P1, and you may recall me mentioning this a few weeks ago, that we seem to have a higher prevalence of P1 compared to the rest of the country, and actually we do. State of Washington has 1,525, which is 24%. And we have 74 cases, which is about 16% of all of our sequence cases. Half of our variants in Spokane, 49%, are not of interest or concern, as they're just variants that have no biological significance at this point. And the reason why I bring those up is because if you recall, when we talk about B117 initially, we stated that this variant was 50% more transmissible than the original wild type virus that was identified early in the pandemic. And it so happens that the Delta and Gamma variants are even more effective at transmission than the Alpha. So as an example, Delta, according to some of the studies that have been released, is 50 to 60% more effective at transmission than Alpha. So by definition, you have variants that are twice, 2-3 times as good as the original virus at transmitting. And we're seeing those in particularly in populations that are not immunized. We're also seeing those in breakthrough cases. By definition, a breakthrough case is a case of someone that is positive or has disease after full immunization. And we're actually seeing those in some of the occasional long-term care outbreaks and so on and so forth, which basically tells us that we do need to be mindful of this. And as we move into more access to a number of activities, we will still need to protect those that are more vulnerable. And more importantly, and this is the bottom line message, the best way to manage these variants is by immunization. So that's why we continue to encourage this on a go-forward basis. It's something to be aware of. It's not something to be alarmed by. It's just to be aware of. And we'll continue tracking those, because at the end of the day, if you recall, and I've said this multiple times, the transmission is the same way, person to person, so there's no other way of doing it. And our goal is to deny the virus a host by getting people immunized as quickly as we can. And there's ample evidence that the vaccine works and works for the variants. So I will keep you updated on that. And hopefully we won't see a impact similar to what has been seen in the UK. And if you look and you compare the UK to where we are, in the UK, the vaccination rates are a little bit different. So I think the immunization strategy that we have here is working. And as long as we continue with that, we should manage this into the future as it becomes more endemic. So more to come on that. I will keep you updated. I'll stop here and see if there are any questions that I could answer from anyone in the audience.
Okay, I'm not seeing questions for Dr. B or for Steve. So Alicia, do you want to go ahead and do an update, and then I'll monitor the chat for questions that could come up.
Yeah, absolutely. Good morning, everybody. Dr. B and Steve, thanks for all that information. Really helpful. I had just a few things I wanted to share this morning. Just going to flip to their page here. I wanted to, on the kind of continued recovery front, just kind of FYIs for folks if they haven't captured, we continue to see relief dollars now flowing from the state for different sectors. So there's a large set of funds that just rolled out to the arts and creative economy this week, actually, from the Department of Commerce. And I think just an important note that we have 50 different entities in Spokane County that are receiving those relief dollars. And that is a combination of nonprofit arts, culture, science, and heritage organizations, neighborhood associations, sports and recreation nonprofit groups, and veteran service organizations. So continue to be able to kind of reach some of these targeted sectors as we move through recovery. Another note is that and I shared this last time, but we're in the middle of the distribution of about 4,000 Visa gift cards as part of the incentive program for the governor's office. That's in partnership with the Department of Commerce, the Association of Washington Business, and the Greater Spokane Valley Chamber of Commerce. And so between now and the end of the month, there are 15 different vaccination clinics that are part of that campaign, and they'll be distributing about 4,000 gift cards. And to date, I believe we're somewhere around 3,800 or 3,900 that are intended to be distributed. So if you want that information to help continue to push that out, please let me know. Any incentive we can have in the marketplace for immunization is really helpful right now, as you all know. And then the last couple of things I just wanted to share is we've had a couple there, and you may have been hopefully paying attention. Like there's the site out there, the tracktherecovery.org. And then we just had a listening session yesterday with some women business owners here in the region. And I was just going to share a couple of things that I think are important continue to think forward. If you haven't had a chance to look at some of the data, and we talked about this a few months ago, Department of Commerce data was showing some similar kind of stats. What they're showing is that from a small business closure perspective, between January of 2020 and January of 2021, Spokane was at 17% in comparison to some of our peer counties in the state, like Pierce County, that's at 31%, or Clark, that was at 51%. And the state as a whole, that's trending at 38%. And I bring it up because I think as we kind of come, full circle in so many different ways, one of the things that we've had conversation on is it really for us is a reflection of a couple of things. One, and most importantly, was the infusion of dollars that our local municipalities prioritized towards our small businesses and nonprofits in our community during the pandemic response that helped for some of that stabilization. That was unique as one of the only regions that had that huge amount of infusion towards small businesses. And so that hopefully is a good trend that we'll see. And the other thing is that I think as we talk about recovery, it's a good reminder, we've seen this with other recessions, that we have a pretty diverse kind of industry base across the region. And so being able to have the balance of some of our manufacturing and health sciences and services organizations that were able to pivot, and they actually continue to have high levels of production, help to balance some of the sectors that were more drastically impacted during the recovery, which comes last to my last comment, which is my conversation yesterday that we had the opportunity to be part of, is that just like the kind of response in this last 16 months has been very uneven, there was just conversation as business owners around that the recovery is going to be uneven as well. And this continued discussion around the mental health and wellness and well-being of workers, the working families and employees as they try to kind of come into this next phase. And so continued discussion around that topic, let alone the many other issues that are challenging. That conversation around the mental health and well-being of people dominated the conversation with those business owners yesterday. And so I just wanted to share that this morning as we get to June 30th and have the opportunity to work on some of the next chapters. Keeping focus on that conversation will be really important for all of us. So that's quickly a few of the things that are on our mind this week and going forward.
Thank you, Alicia. I know the recovery dollars and just how we continue to proceed as communities are going to continue to be a big topic that we're all really focusing on and watching. I think the behavioral health piece is going to be huge in all of this as we go forward. And I think, Steve, I apologize. I think I skipped right over you, which I have actually done to GSI in the past. So any general response updates?
Hey, no worries. I'll be really quick on this part. So really for the general response, we, like everyone else, are super excited in anticipation of the June 30th announcements from the governor. But with that, we are still focused on what we've always been focused on, which is, controlling this disease through investigation, promoting vaccination, and working with our communities that are most disproportionately impacted by COVID. Internally, we're reviewing and planning for tomorrow, what we're going to hear tomorrow, anticipating guidance, as well as kind of moving into this endemic phase, which I know Amelia will talk about here shortly. For disease prevention, disease cases have decreased across all sectors, including long-term care and child care. As Dr. Velazquez mentioned, we are analyzing results from the school superintendent survey. Our testing has slowed a bit. We're really just consulting with summer camps, but last week we did do quite a bit of testing in the shelters. As far as the vaccinations go, last week we administered 267 doses in-house. That brings our total that SRHD has administered to 33,498 doses. That's a small and mighty team that's really working out there. We have not ordered new vaccinations this week. It has slowed a bit, and we have canceled several clinics due to the heat. Last week, we did serve for the vaccination group, private businesses, our syringe exchange, shelters, homebound individuals. We were at Riverfront and Cannon Parks. We worked with the city fire locations, the county fire locations, and schools. And we are actively reaching out to events, food pantries, and really anywhere to help schedule clinics. And that's open. Please, do reach out. We're trying to get out as broadly as we can in the community. So with our environmental public health, they have really been working with the water recreation program and reviewing the COVID safety protocols, including, some of the adaptations given the heat. We have our weekly summer camp office hours that we continue to hold. And we're continuing to follow and update the guidance as tomorrow approaches, like everything else. For community health, we have been meeting with our community and faith workers and supporting vaccine clinics where we can. Communications, I'm sure Kelly can say a lot more. We have done our Facebook Live on food assistance, summer camps. We have blogs on events and venues, summer food programs, our Smoke Ready Week, and really this week a lot with the heat safety and how to get out there, as well as promoting clinics, our WIC and SNAP benefits for the summer, and vaccines. And that concludes that report. If there's any questions?
Thanks, Steve. Oh, go ahead, Dr. V.
It's actually not a question, but I neglected to mention when I was talking about the cooling centers, the cooling center in Spokane Valley, which we did include in the information we released. So I just wanted to make sure that we were aware of the fact that Spokane Valley has also identified a number of cooling centers that are part of the information that is available in print as well as on the website. So neglect to say that. Sorry, Mayor Wick, I forgot.
Yep. Go ahead, Doug, and then maybe I think Commissioner Kearns has a question.
Oh, she can go first.
Oh, go ahead, Commissioner Kearns.
Thank you. So a couple of the things that I've heard kind of sparked a question for me. So 2 weeks ago, statewide, weren't we in the mid to high 60s for vaccination rate approximately about 2 weeks ago?
Yes.
Okay.
Yes.
So the incentives for vaccines has really taken off over that 2 week period, but it doesn't really seem to have made that large of an impact on that number. I mean, only ticking it up just a few percentage points. Is there any thought to that? I mean, are we just reaching that level of those that want the vaccine have gotten it, those that don't want it aren't going to get it? I mean, it just I would have thought the incentives would have ticked that number up at a greater rate than it actually did. I mean, did anybody have any thoughts on that, or is there a backlog in the data, and maybe we are above 60%, and those numbers just haven't been included yet? I mean, any thoughts on that?
I can make a couple of comments, Commissioner. So over the last couple of weeks at the state level, the Department of Health and the governor have said that there's a little bit of a slowdown in the uptake of vaccine. And if you recall, we've stated that some areas of the state moved really fast and then plateaued. Spokane County, on the other hand, has been steadily inching forward. And the reality of the matter is that we're reaching a point where now for the immunization to be successful, we have to really work very specifically for those groups for whom there's either vaccine confidence issues or for those groups for whom vaccine is not a high priority, which our strategy, I think, is probably the best strategy, which is smaller, deployable, go where the people are, try to make it part of their activity, try to make it part of their schedule. So I do believe that will continue to be effective. And we did see a decrease in the large mass vaccination sites, which is one of the reasons why the state retreated some of those. But we continue to see significant interest in smaller. As an example, there was a vaccine clinic this Saturday at El Mercadito, looking specifically at our Spanish-speaking population, which is one of the groups that still has some vaccine confidence issues. And I think we were able to get about 53 people in that event. So this 30, 50 at one time is what is going to continue making a difference. Those, as you pointed out, is very accurate. The initial wave of those really wanted the vaccine. They've already gotten the vaccine. Now we have to work on those for whom confidence and or convenience is more of an issue. And notice I didn't say access, because there's really great access right now. It's pretty much almost anywhere that you can find. Is more of getting it as part of the flow, as well as having very specific conversations with those groups in which vaccine have still confidence issues for a variety of reasons. One of the things I've heard a lot, particularly in the 20 to 39, is many of them are working, and because a lot of things have opened and there's a little bit of a shortage in some specific essential services like restaurants, some of them are working 2 jobs right now. So the convenience factor becomes a big issue. And we're taking that into consideration. Steve had mentioned that through our events and venues and other points of access, we are looking for any place in which we can plop a vaccine clinic with a farmer's market or a community-based event, just to make it easy for people to get it. Now, this week, we're being extremely cautious with any outdoor activities, but in general. So I do believe that the Spokane County strategy will continue to work. And we do have some work to do with, as I mentioned, in terms of the convenience and in terms of the confidence. But every day, I think we improve on that. So that's a very accurate observation.
Thank you.
And I wanted to point out in the chat, Doug and Kathy both mentioned that there are cooling centers in Medical Lake and Liberty Lake. So we will make sure to add that information to what we have related to cooling centers. Also, I think the governor did released restrictions off of the number of people who can be in cooling centers. So that should be helpful as well. Any other questions for Dr. V or Steve before we talk about where we are in our recovery phases? Go ahead, Doug.
Just a couple of quick questions. So Governor Inslee's talked about this bridge time for before evictions can happen and shutoffs can happen for utilities. And he was talking about how the money is there to help people out. Do we know where that money is? Is that SNAP in our area? Is that where we're directing people who need, who are going to be facing eviction when this very last sort of reprieve was given for 2 months, however long it was before evictions start? Who's our local? I know I keep asking Alicia, and I know it's probably not GSI, but the governor made it sound like there's a pool of money out there for people to access, and I just would like to know who has that money. And then the second thing is, are we concerned tomorrow when the message is everything's open that all of a sudden everything just stops? I mean, does that truly mean that you throw your mask away and everything is 100% and every building's open? Do we know what exactly fully open is going to mean? And are we concerned that all the efforts then just cease with that messaging and everybody just thinks life is great again? Thank you.
So I saw Commissioner CUNY's hand pop up, so she can answer some of that. And I think, for the second part of that related to what's it going to mean, right, based on what the governor is going to announce tomorrow. I think we at the health district are still waiting. We don't have that message yet of what he's actually going to say. And we don't know if we will receive it before he says it or after or how that will work. So, we'll just have to kind of stay tuned there. But Commissioner CUNY, go ahead.
Yeah, I can speak to the rent assistance. So Spokane County, we have, we provided SNAP with $9 million of our funding for rental assistance. So SNAP for Spokane County is kind of where to send people for that. I know at this point in time, they have not used many of those dollars yet. So please encourage people to talk to SNAP and to have them help them.
And that's thank you for that answer. And that's for utilities also, Commissioner CUNY.
I believe so. I think it's both, but I don't know exactly. I think so. So check with SNAP though. They're the ones that we contracted our funds with to handle that on our behalf.
And we'll, I know for Medical Lake and probably for most others, we will use the recent round of funding to help with those things also. But I keep hearing kind of the governor talk about this bridge to give time to get money to people. So apparently it's available, and I just was checking on that. So thank you.
Yeah, no, and we just really want to encourage people to start to, go for those dollars, rent assistance dollars, because, they're there. I mean, Scott Simmons is on the line. He might be able to speak. He's talked to SNAP here more recently to know what the numbers are. But I believe that maybe not even $1 million of that has been requested so far. So it's really important to have people go and use, before you use your dollars, because you may need your dollars for other things. Let's get those dollars out there in the community first.
And I would just add on, Doug, that both one of the folks in my meeting yesterday was the people aren't accessing the rental assistance, and the same with utility. And I mean, even Avista was in there, and Avista's had utility assistance available throughout, and they've had very low utilization of it, people actually reaching out and accessing. So I think part of this is getting folks to connect to some of those different, but the motive, it was an interesting conversation and some frustration around it, but there's a lot of money out there. But getting people to apply and take advantage of it.
And we'll do, at least for Medical Lake, we'll get it on our Facebook page. I think the focus is so much on evictions that sometimes we forget that utilities are a huge part of this too. I mean, we will, we'll hang 400 door knockers for shutoffs when the moratorium is, when the moratorium is lifted for shutoff. So I think we need to talk about utilities also. Electricity is the popular one, but water and sewer is equally, I think people are behind on those equally as much as they are with electricity. So
Doug, just so you know, Spokane County, we use $2.5 million of our CARES funds for utilities directly to the utility companies at the end of the year. So we contacted all the utility companies in Spokane County. The total amount of past due was $5 million. We put $2.5 million towards that. So there's numbers that are out there that they're trying to say it's 18 million and all this stuff. That is not true. Again, when we did that at the end of the year, it was $5 million was the total past due. We put $2.5 million and let the utility companies figure out where to put that within their system. So people are not as far behind, I don't think, as we think. But they still are. I mean, we're now 6 months past that. But just so you know, I mean, that was done at the end of the year to help people with their utility bills then.
And we did the same thing. We paid off all delinquent water, sewer, and garbage bills with one of the rounds of the relief money. I just know, looking at our accounts, that we're back up there, and that may be just unique to Medical Lake, but I think it's good to remind people that utility money's out there also, as well as rent help. So thank you for that.
Other questions before we start looking at where we are in the response phases? Okay, so Anne is going to put up on the screen an updated, a few months ago, we had looked at where we are in the response phases of kind of in that readiness, activated response, and then true like emergency response. And you may need to make it a little bigger for folks. Not sure. But, the health district, and I brought this up at our last meeting, we are moving into the phase where we will be monitoring COVID like any other communicable disease. And if you scroll down, and Ann will show here, we've gone from kind of incident command into now needing to do our work here at the health district to determine, how we go in to monitor from this, kind of readiness activated into our daily work. And so I think one of the things that I think we need to talk about at this group is, as the conversation moves more into the eviction, moratorium, community response, economic response, how, the health district's kind of been running these committee meetings and bringing them together, but is it better suited for this to kind of move to another group to facilitate? So interested in getting feedback from you all on where we want to go next.
Well, I'll just pipe in. I think this has been, really helpful and all of that. I'm not sure where that forum will be to continue the conversation. I think that, Amelia's, my thoughts is we've got to get past June 30, which is, tomorrow, but yet we don't know what tomorrow's really going to bring regarding the governor and what's going to be open and how he's going to treat the emergency status. So, I think I know I wasn't able to be on last week, but I think we need to, really think about what that means. And do we have one more meeting after June 30 and then really figure out where, that should really be the topic is how do we transition this and what is that, going to be? I think you were hoping to have that today, but I think until we get to tomorrow and see what the governor's really going to choose to do, I don't know. If we're still based on, vaccination numbers and all those things, we need to continue to have this conversation. So that's just my thoughts.
Yeah, I definitely, I hear those. I think that one of the things that we're really trying to figure out here at the health district, because this committee was actually created out of the EOC, that this, I think, was part of the, like a regional governance group that kind of got redesigned or kind of configured to deal with response things. I don't know that we at the health district know like who makes that decision. Commissioner CUNY, I think that's part of what we're looking for, of like who kind of steps in, at any of it. I think I just kind of started facilitating the meetings because it was so health district heavy. And then I think the other part of it is that a lot of the information that we're giving from the health district perspective is all available online. So that's what part of what we're trying to figure out. And I'm fine if we wait until after the next meeting, right? Like if we did our next regularly scheduled one, because that would be after the governor's discussion, but I just don't know then where we go. So wanted to make sure I brought it to the group.
I would just add on, to both of your comments. I think that, yes, waiting until kind of after, even one more post June 30th discussion, kind of see what happens, is good. And then what I would add to Amelia's comments is that I believe both GSI and the health district were added to an existing MOU for an existing council structure between the county and the cities as part of this bridge from emergency operations to this entity. And so we can certainly pull that back up in between as well. I'm sure I still have a copy of the MOU. We had to sign on to it. That's what I remember from the structural pieces back in.
Yeah. No, you're correct.
Correct.
So maybe, because it did come out of the EOC and kind of the emergency status, which is the county, maybe, we as the county commissioners, in between, maybe I think Josh is still on the line. Maybe we can have a discussion about this afternoon to see where to take it and where to go, who to facilitate. I think it's still, I don't know. I mean, I guess that's, I would appreciate input from others as to, are we feeling this is, worth everybody's time in that, if it is all available online, is there, and you produce those reports that you send to us, and I know the health district we have lots of other things to be doing as well, as well as all of us elected. So yeah, so I think it's really, true at this point in time. I'd like to do one more after, we get past June 30 and then, really look at it. But hopefully maybe we can have a conversation as the commissioners this afternoon just to talk about it. And if anyone has any other comments, that'd be great.
Go ahead, Katie.
Thank you. So I totally agree on waiting till after June 30th. Something that, Amelia, that we might consider is after June 30th, what do we see as continued gaps or deficiencies? And then kind of customize a response or a strategy along those so that it's not generic, it's very targeted to where we still have issues in the Spokane County area. So whether it's utilities or evictions or immunizations or whatever it is, it's hard to know right now, or business support, I can't identify it, but I would just say, let's identify where our shortfalls are so that we could be targeted in our response.
Okay, thank you, Katie. And it looks like Brian over in the chat has put what we can potentially impact or expect post June 30th. There's a link there. Other questions, comments?
I'm going to say, Brian, I just tried to click on that link and then told me the page is not found yet.
Okay, let me try to re-add it.
It pops up briefly and then you get a message that the link is broken.
If you take the last period off of the link, it'll work.
Okay, yeah, it looks like it just made it like a sentence, like it. So if you take after, yep. Thank you, Brian. All right, so
awesome, thank you.
Based on what I'm hearing, it looks like the health district will facilitate a meeting on the 13th. And hopefully at that meeting, we can maybe hear who will be helping or kind of coming into some of that facilitation role as we continue to demobilize from the active response. So we will include the phase, the document that Ann had up on the screen in the minutes, just so folks can see that and have a reminder of where we activate during the different phases of that. So any additional questions or things as we wrap up? All right. Well, if not, I will see you all back here on July 13th for our next meeting, and stay cool. The information on the cooling centers, the health district will also add into our information, and anything you can put out, I think, on your Facebook or social media about the cooling centers for us is helpful as well. So thank you, everyone, and see you on July 13th. Bye-bye.